called central baroreceptors. Okay, central baroreceptors. So if this is the heart, if that is the heart, okay, then we have the aorta, ascending aorta. So the ascending aorta is going to make an arch like that, okay? Now, just somewhere right there, we have what is called a baroreceptor here. Okay, so we're talking about regulation of blood pressure, remember, okay? Then, from the arch of the aorta, we have blood vessels that branch off there, okay? So we are going to have a blood vessel going up like that, another one like that, and then it branches off. One goes inside like that, the other one goes out, okay? The other one goes out here also, then the other one goes in, okay? Okay, so these are called the carotid arteries. There's the left carotid artery, and this is the right carotid artery. Then here it branches off. We have the external, the left external carotid artery, okay? Then we have the left internal carotid artery, okay? This side we have the right external carotid artery. Then we also have the right internal carotid artery. Now, on the internal carotid arteries, we also have baroreceptors there. Now, these are what are called carotid sinuses. Okay, carotid what? Sinuses. So those are central baroreceptors. Now, what happens there? Okay, what is going to happen in that case? When there is increased blood pressure, okay? When there's increased blood pressure, okay? These baroreceptors are going to have two effects, okay? They're going to, one, they're going to inhibit what is called the cardio acceleratory center, okay? So the center that is responsible for the heart beating fast, it is going to be inhibited, okay? Then it is also going to inhibit contractility, okay? Contractility is also inhibited, all right? When there is low blood pressure, okay, when there's low blood pressure, the opposite is going to happen. There is a stimulation of the cardio acceleratory center, okay? Then there's going to be stimulation, or rather increase in a contraction, okay? Like that. So remember, you can see that here, what is happening. By the way, how is this happening? It's because this sends a signal to the adrenal glands as well. So there's going to be a signal to the adrenal glands, and then there's going to be production, either production or inhibition of production of those catecholamines. All right. So basically that is the physiology of blood pressure. That is the regulation of what? Blood pressure, basically. Okay. I really hope much of the information that is needed on these aspects, we have touched those aspects. Now, let's now go into, I don't know if there's a question or maybe a contribution, someone wants to add something to what I've said so far before we go into hypertension. Now, I'm not going to mention much about hypertension. We're just going to grade hypertension and then look at the classes of antihypertensive drugs. That's all, okay? Any question or contribution from what I've said? Anyone with a question or contribution?
Could you please repeat on the baroreceptors and their mechanism?
Okay. So what happens with the baroreceptors is that, remember I mentioned that there are two, the aortic, the ones on the aortic arch, okay, aortic arch, all right. Then other than that, we also have baroreceptors where on the carotid sinuses, what are called the carotid sinuses. That is on the left and right internal carotid artery. Now, when blood is passing through those baroreceptors, okay? Remember, when you say baroreceptor, it means we're talking about what? Something that is able to detect what? Pressure, isn't it?
Pressure.
It has cells that, or rather nerve endings that are specialized in sensing what? Sensing our blood pressure, okay? So now, when they sense that that blood pressure to be increased, we don't want a lot of pressure. What happens is that there's going to be inhibition, okay? So those baroreceptors, they're going to send a signal basically or mostly to the adrenal glands, okay? Such that there's going to be reduction in the production of catecholamines. Remember I said that catecholamines, that is noradrenaline. Noradrenaline is positively dromotropic and positively inotropic. In other words, it increases the heart rate, it also increases the contraction, the force of contraction.